Hello, everybody. Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health specialist Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. It's something we're doing on the first Tuesday of every month at 11 a.m. Throughout this chat, we encourage you to ask your questions by simply typing them in the chat window at right, and we'll do our best to answer those questions. In today's chat, we're going to discuss joint replacements. You know what, in 2003, about 652,000 total joint replacements were performed, mainly on the knee and the hip. By 2030, it's projected hip replacements will rise by 174% and knee replacements by 673%. Surgeons can thank aging baby boomers. They're more active than their parents, and they refuse to accept the pain or give up their activities. Joining me today will be Dr. Robert Greenhow, an orthopedic surgeon from Centennial Medical Plaza. He will join us in progress. And Kim Gorman, weight management program director of the Center for Human Nutrition, UC Denver. All right, Kim, let's begin with weight. I think this really does factor into the need for joint replacement. I know we talk about arthritis and weekend warriors who really wear down their cartilage, but how much does weight factor in?
You know, I brought something interesting today. Here's 1 pound of body fat, just a visual for people to say, well, you know, I've got 40 pounds to lose. What's 1 pound? Well, actually, 1 pound of extra body weight on a knee joint can be comparable to 4,800 compression pounds when you walk on that joint, knee to knee to knee to knee. So 1 pound is a big deal, and I think, you know, from a dietitian's perspective, we look at 1 pound of fat is 3,500 calories.
Wow.
How do we actually pull that out of our diet?
And, you know, we talk about losing weight and we talk about, oh, I only lost a pound. That's quite a bit, isn't it?
It certainly is. And I think one of the fun things to do, like at a grocery store, is pull 2 pounds of red beets and pull 2 pounds of grapes and walk the perimeter of that store, drop those things down in your grocery cart then, and feel what it's like to walk 4 pounds lighter.
That is true. And when you lose 5 pounds, they say you start with 10% of your body weight. Correct. If you're really trying to lose. Doesn't sound like a lot, but it really is. It does add up, doesn't it?
Sure does. It sure does.
Wow. Well, tell me, what are some of the ways to do this? I think a lot of people always say, yeah, it sounds easy, but I can't do it. It's so hard. Yeah. I know you have some tips.
Sure. 1 pound of body fat, though, it's a very, very short-term goal. And I think of it in terms of a month. What can you actually do in a month's time? So if we take 3,500 calories necessary to pull out of your body's energy store there to reduce by 1 pound, we look at small things. How can you pull 100 calories out of your diet? 100 calories a day is about 1 pound in a month's time. So if we can multiply that, we can say, well, if we pull 500 calories out, we might see 4 to 5 pounds at the end of 1 month. So one of the neat tips that I brought today, I was just out shopping, you'll find these little spritzers.
Love
these are little, so instead of using a couple tablespoons of dressing, you might use a squirt. So every squirt is 2 calories.
Yeah.
So there's one easy way to pull off 100, 150 calories just at your salad. If you're somebody that does it on a day-to-day basis, that'll get you 1 pound weight loss at the end of the month.
That's a great one.
One of the other things I pulled out, one of these spritzers, if you're a butter or margarine user, again, you use the spray, so you're getting 0 calories, and per tablespoon of margarine or butter that you're pulling out, you're saving another 100, 150 calories.
Now, what about the people who say about these products in particular, oh, is that good for you? I don't know, you always hear so many.
You know, how's your vision here? Look at
really
look at the first ingredient on there.
Can't see it. You
Water.
Tell me. Oh, is that it? Okay.
So, you know, I'm not going to worry so much about, you know, we're talking about joint replacement. That's years and years and years of wear and tear. It's years of excess body weight, wear and tear. And so if it's a matter of making a couple small changes in the diet to reduce the body weight, give a little relief on that joint, it's a win situation.
Absolutely. You have some other examples.
I have some other ideas. This is kind of, I think it's kind of interesting. I brought a piece of bread that I cut in half. A lot of folks don't realize, you know, if you have a sandwich with an 80, 100-calorie piece of bread, what if you had the same ingredients in the sandwich, but you said, you know what, I'm going to do a half a sandwich instead of a whole sandwich. And then it's working your mind around the idea of, this is enough for my body.
I have another idea on that one. What about that low-calorie bread?
You can do that.
It's great.
Yep.
Tastes the same.
40-calorie slices of bread. So now you got, it looks like the full-size sandwich.
Right.
It's another way. Again, so if there's 1, 2, 3 of these that you do on a daily basis, now we're getting close to 3 to 4 pounds of body fat coming off at the end of a month.
Okay. We'll go to some of your other things. Dr. Greenhow is joining us now on the telephone. Dr. Greenhow, welcome. First of all, is it arthritis that leads to joint replacement?
Typically it does, yes.
And describe arthritis for people who really don't know what it is.
Arthritis is a condition where the cartilage that lines the ends of the bones in the joints wears away. And and it's a condition that leads to pain and swelling and stiffness and ultimately loss of function.
Well, how can you treat it?
There's different treatment options, and it depends on how severe the arthritis is. If it's early, things like anti-inflammatory medication, rest, weight loss, if it's an issue, can help. Use of a cane or a crutch, and ultimately working your way up through other treatment options, including injections like cortisone, and then all the way up to surgical options such as a joint replacement.
Is that the last resort?
Yeah, that's typically the end of the line when it comes to joint replacement, or when it comes to arthritis. Yeah, that's sort of the definitive treatment to replace the joint.
We've been talking about trying to ease up on your joints by losing some weight. Can that help so you don't have to get to the joint replacement part?
Absolutely. If weight loss is an issue, it can make a big difference. They've done studies showing that even losing 1 or 2 pounds can make a significant difference in terms of the amount of force that goes through that arthritic joint.
All right, Kim has been showing us some things, some ways to try to lose that. Kim, let's look at a few others, then we'll get back with the doctor.
One of the big visuals, I think, your plate size, the beverage size, this is 24 ounces. So you're looking at 3 cups of a liquid right here. If it's a calorie, say it's sweetened tea or you have regular soda pop, that adds up. So we're talking 300-400 calories in something like this that we're not even aware of. So if this is something that we modify with something that's non-calorie like a water, or there's all kinds of sugar-free beverages available, that's a way to start pulling, again, 300 calories,
right,
400 calories, 500 calories on a daily basis that turns into a nice amount of weight loss.
Right. All right, Dr. Greenhow, so you get to that point where you feel like it's the last resort, you're in incredible pain, you need to have that joint replaced. Who's a good candidate?